Hello, everyone. And welcome back to Navigating the Periphery. As always, my name is Deborah, and this is my co-anchor, Philip.
Hello.
How is everyone doing today? If you are into what we're doing on this channel, you know what to do. We want to try and get our message out there and try to reach and help as many people as we can. Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis one show at a time. And if you know anyone who could benefit from watching this channel, please help spread the word.
Remember, it's okay not to feel or be okay all the time. You are not alone. We're here.
So, Philip, how are you doing today?
I'm doing great today, Mom. How about you?
I'm good. And I am excited to discuss today's topic. But first, a quick disclaimer here. We are not medical professionals.
No, we're not.
Ha.
Haha. Our channel is for information and education purposes only, and I'm speaking to you guys out there from my personal life experience, with OCD, GAD, and my schizoaffective disorder mixed type. So please refer to our full disclaimer at the end of this video and every episode that we put out.
And don't mind the fire siren in the background.
Today, we are going to navigate the periphery of TMS, or Transcranial Magnetic Stimulation. My psychiatrist now has a transcranial magnetic stimulation device slash machine in her office. Now you may wonder, what is TMS? I wondered too, so we did a brief but deep dive into it.
TMS, or Transcranial Magnetic Stimulation, is a non-invasive brain stimulation technique that uses magnetic fields to stimulate nerve cells in the brain. It is primarily approved for treating major depressive disorder, or MDD, and treatment-resistant depression. But emerging research suggests it can also be beneficial for other conditions, including schizoaffective disorder mixed type. Schizoaffective disorder mixed type combines symptoms of mood disorders, depression, or mania, with psychosis, hallucinations, delusions.
My new psychiatrist is now offering this treatment in her office. Now, my depressive symptoms were pretty resistant over the last 2 years, until I went on Lamictal this past August. I'm doing phenomenally well on Lamictal, so until that no longer works, I'll probably stay on it and have my dosages adjusted accordingly as my depressive episodes ebb and flow, which happens with schizoaffective disorder mixed type. However, I am still interested in how this medication-free treatment works and how effective it is. Managing depressive symptoms in schizoaffective disorder can be challenging, but TMS has shown promise. TMS is FDA approved for major depressive disorder and has shown significant benefits in reducing depressive symptoms. For individuals with schizoaffective disorder mixed type who experience severe or treatment-resistant depression, TMS might help alleviate mood-related symptoms, which is great.
The Food and Drug Administration, or the FDA, has approved transcranial magnetic stimulation, or TMS, as a treatment for major depressive disorder and, more recently, obsessive-compulsive disorder. Depression involves symptoms that overlap with depressive episodes that occur with bipolar disorder, leading some experts to question whether TMS would be beneficial for bipolar disorder too. Though TMS has been used to treat depression since 1985, researchers only recently started looking at the potential benefits of TMS for bipolar disorder.
So, you may be wondering, well, how does TMS work? TMS uses magnetic fields to stimulate nerve cells in the brain. A device, typically placed near the scalp, emits repetitive magnetic pulses. The pulses are aimed at specific brain regions, such as the prefrontal cortex, which plays a role in mood regulation. The stimulation can help reset the brain's activity, promoting neuroplasticity and improving mood. Sort of like a mental reboot, but far less severe and far less dangerous than electroshock or electroconvulsive therapy. And the side effects are pretty minimal and don't occur in everyone treated.
Yes. The side effects are mild: headache or scalp discomfort, and in very rare cases, seizures, which is extremely uncommon with proper medical screening first, which I should point out is vital in any treatment scenario for depression and/or major depression. The procedure itself is pretty simple and uncomplicated. Patients sit in a chair, and a magnetic coil is positioned over the targeted area of the head, and these sessions usually last about 20 to 40 minutes and are typically conducted 5 days a week for about 4 to 6 weeks. A huge plus is that the patient remains awake and the procedure is considered non-invasive. Patients are awake during the session and there's no need for anesthesia or recovery time.
So let me close this episode with the pros and cons of TMS therapy. First, the pros. It's non-invasive. TMS is a non-invasive brain stimulation that's less invasive than other treatments. It is drug-free. TMS is safe to use with other medications and doesn't have the same systemic side effects as the antidepressants. It has shown to be effective for treatment-resistant depression. TMS can be an alternative for patients who don't respond to antidepressants. There are minimal side effects. TMS has fewer side effects than other mental health or disorder treatments. And the risk of seizures is very low, especially when conducted by trained professionals.
And here are some of the cons. There is a time commitment. TMS requires regular sessions, usually 5 days a week, for 4 to 6 weeks. TMS can be costly if it's not covered by your insurance. There may be limited availability. TMS is a relatively new treatment, so there may be a waiting period for appointments. Patients may experience mild discomfort during treatments such as scalp discomfort, headaches, or muscle twitching. And there is a risk of your depression returning. Studies have shown that 40% of patients may experience some worsening of symptoms within 3 months of completing TMS. Also, some insurers have strict criteria for covering TMS therapy. And again, the conditions that TMS can treat are major depressive disorder, FDA approved obsessive compulsive disorder, and anxiety disorders. TMS therapy for anxiety disorders is considered an investigational use, meaning it is not yet FDA approved for this purpose, but has shown promise in research studies. Some chronic pain and PTSD, in which research is still ongoing. And bipolar disorder. In 2020, the FDA granted TMS breakthrough device designation for treating bipolar depression. This designation indicates interest and provides an expedited path for FDA review.
Evidence shows that TMS is effective in the treatment of moderate to severe depression. In patients with a history of treatment resistance, depression has been linked to an abnormal function of nerve cells in a specific part of the brain. Highly focused magnetic field pulses used in Transcranial Magnetic Stimulation, or TMS, therapy gently stimulates these nerve cells. New data emerging from recent studies suggests that in most patients, the clinical benefits of TMS therapy are maintained through 12 months, which overall is a positive outcome. Let us know what you guys think in the comments section down below. I'm curious on your thoughts, and remember, it's okay not to feel or be okay all the time. You guys and gals are not alone. We're here.
And that we're trying to stop the stigma of a mental health diagnosis one show at a time. So let's get a conversation going. Let us know what you think about TMS, or if you guys know anything about it that we didn't cover, leave a comment. And we'll see you on our next episode coming really soon. So take care, have a wonderful evening, and bye for now.
Bye!